Coming up on episode 55 of Omnivore, how GLP-1 drugs are sparking food product innovation, exploring new frontiers in precision fermentation, and a few thoughts on obesity and food as medicine. This is Omnivore, from the editors of Food Technology Magazine and the Institute of Food Technologists.
This episode of Omnivore is brought to you by IFT Virtual Workshops, where you stay in the know instead of on the go. Learn more about all 4 of our exciting new virtual workshops on the career development page at ift.org.
Welcome to Omnivore from IFT and Food Technology, where we explore the intersection of business, science, and technology in the global food system. I'm Bill McDowell. Over the past few years, early adoption of anti-obesity medications, led by glucagon-like peptide-1 agonists such as semaglutide and tirzepatide, has skyrocketed. These powerful drugs, prescribed for both type 2 diabetes and weight loss, work by mimicking a unique gut hormone that suppresses appetite and slows digestion. As the number of GLP-1 users grows, their individual eating and food purchasing behaviors are evolving as well. Food and beverage companies are still trying to figure out how to best respond to the new landscape. Food Technology's Mary Abood spoke with Barb Stuckey, Chief New Product Strategy Officer at Mattson, about product development opportunities and challenges as companies digest the impact of these emerging drugs.
So let's just start out by hearing a little bit about the research Mattson has done around GLP-1 users. Talk to me a little bit about the nature of that research, and then we can get into the findings.
Sure. Well, this was something that we started to hear about in late 23. And just because we're watching dietary trends as food and beverage innovators, we really were intrigued by it. And our CEO, Justin Shimmick, who many of you may know, also has a nutrition degree in addition to his PhD in food science. So he was really supportive of us doing a really deep dive into what GLP-1s are, how they work, and then most importantly, and this is really, this is the Mattson signature part of it, is how do these new weight loss drugs impact food and beverage behavior? And so that was the focus of our research.
What would you say the top findings have been from your research? If you had to pick maybe the 1 or 2 most surprising or, sort of pivotal findings, what would they be?
I think the most astounding finding is just the number of people that are currently on the medications and what the projections are for how many people could be on them in the future. Right now, in February of 2025, there is about 6% of the US population that is on these medications, which is enormous just in and of itself. Mm-hmm. And of course, the 2 main reasons that these meds are prescribed is for obesity-related indications and for diabetes. However, we have seen some new projections, and what the projections show us is that while we're only at 6% usage right now, those who are eligible to be on GLP-1 drugs represent 52% of the US population. That's more than half of all the people that live in the US. And this is only for the drug's intended purposes around obesity and diabetes. This is not for any of the other comorbidities that it seems to be working with. So the scope of this is so enormous. And that's what we don't think people really understand. And specifically the food and beverage industry. As you probably know, not a whole lot of food and beverage brands have been offering up solutions for these consumer needs. And so we're a little bit surprised about that, just given the magnitude of what we have seen in the projections.
What are some of the big opportunities?
So the first thing that I want to communicate, and where we think there's this enormous opportunity is that because the weight loss on these medications is so rapid, it is much faster weight loss than any other traditional style, even bariatric surgery, when it comes to how quickly the weight comes off.
Wow.
And yeah, it's really profound. Again, we have some statistics on that. But the result of that is that when you lose that much weight that fast, you tend to lose more lean muscle mass. And of course, anyone who's on a major diet knows that keeping the muscle mass is critically important. So what we really need to do is to be offering these patients higher protein options of everything they eat, because getting protein in to keep that lean muscle mass is just really critically important. That's the first opportunity. And then the second opportunity is, again, because of the rapid weight loss, that there can be some dietary deficiencies that show up as a result. And so we're talking about things like micronutrients, like vitamins and minerals. And so just making sure that they're staying in touch with their doctors while they're on the medications, and fortified products, dietary supplements that provide just a really well-rounded kind of multivitamin-like thing would be really helpful too, just to make sure that they're not missing any critical nutrients. And then the other thing is just avoiding or treating the side effects of the medications. And many people, actually quite a large majority of the people that go on GLP-1s do have some side effects. Some of them are very minor, others are significant and cause people to go off the medications. Mm-hmm. But they're usually around GI distress. So, there's a mixed bag of some people who end up with diarrhea and others who end up with constipation. And some people have just an upset stomach that makes them nauseous. Some people actually, end up so nauseous that they get sick. And what's good to know is how the drugs work in the GI system. And what happens is that when you take these medications, the gastric emptying, meaning the time it takes the food in your stomach to move into your lower GI tract, mm-hmm. is reduced. And so it's much, much slower. And so you stay fuller longer. Now, that's okay if you eat the right amount of food, but just a tiny, tiny bit more than your stomach is able to handle causes significant GI distress. So it's really important. This is another opportunity for the food and beverage industry to help patients. Consumers really need to eat much, much smaller servings. And they also need to be conscious of what's in those smaller servings. So things like spicy foods, things like carbonation are specific things that can exacerbate any GI distress. So, you just really have to have these products that contain protein and micronutrients, but don't upset the GI system. And then finally, and I'll stop talking about the GI system, because of the slowing of the gastric emptying, there can be some regularity issues. And so it's super important also that these patients get enough dietary fiber and that they're drinking enough water or hydration beverages. So you can see how many different categories could play here in these opportunities to help the patients.
Could you share any of the food and beverage concepts Mattson has proposed?
Yeah, so obviously we can't talk about any work we're doing for clients because that's all confidential.
Of course.
But what we did was, like I said at the beginning, we approached this as we would approach a client project. So it was first about learning everything we needed to know about the consumer and the consumer needs and wants. And from that, we then used our Rethinking AI ideation tool, which is enabled by AI to just help us create more concepts faster and with more depth. Mm-hmm. So we did these two different ideations. One was focused on consumer packaged goods for things you could find in the grocery stores. The other was focused on food service menu concepts, things you could find in restaurants. So I don't think you're going to be surprised with what we learned. So the first thing was that just the right portion size was critically important to people. And I'm just going to give you this quote because this came from one of the consumers that we tested these products with. So the quote is, "The foods themselves aren't the issue. It's the amount of food you eat. If you eat too much, you'll throw up." And so that is a significant problem. And, so looking for smaller portions, individually wrapped portions that you can eat that give you the nutrition you need. So one of the things we tested was grilled chicken strips. And, this was something we thought could replace if a string cheese, a cheese stick. Instead, you get a lean portion of chicken that's been grilled. And so you're getting some real nice, lean and clean protein. It's individually wrapped. That was one of our highest scoring concepts. Consumers just really saw that as something not only that worked for them during the weight loss journey, but this was something that you could throw in a kid's lunchbox. It's something you could eat during a conference call. It's something that just had a convenience aspect to it. So that was really important. And then the other thing, of course, is nutritional fit. So, here's another quote that we got from a consumer who said, "I would say making sure you're having enough protein helps with not becoming nauseous while on the medication." So we heard that a couple of times, that having protein in your stomach for some reason is just more soothing to the stomach than having other macronutrients.
Interesting.
And yeah, very interesting. There's a lot of really interesting things. One of the things that I'll just bring up, since you said interesting, there seems to be something happening with taste and smell preferences, that they are changed as people get on the drugs. So things that they were craving before are no longer appealing, and they are craving things that they've never craved before. So, and we're not really sure what that is about. I don't think anyone really knows the mechanism for what's happening there, but we've heard that from multiple consumers. And, we did some video interviews, and people talk about, having a hard time in the grocery store because some of the sections of the grocery store have a really unpleasant smell to them. It's just a really, really, it's a really dynamic interaction with the body. A lot happens, and, we know some about it, but we don't know everything.
This sounds really powerful in terms of actual consumer purchasing behavior.
Yeah, the way that you just said it is very similar to the way that I think about it. I feel like these drugs are teaching people how to eat healthy without their knowledge, without their permission and without their knowledge. So, we have people that say, I'm craving cucumbers, the crunch of an apple. These things are just absolutely tantalizing to me now. And I just never used to crave an apple or a cucumber. So yes, fresh produce is very well positioned to help consumers get the right nutrients they need to be hydrated. Just think about high moisture fruits and vegetables, berries, and, things that like lettuces, where they're easy on the stomach, they provide nutrients, they have a crunch, they have a fresh taste. And we have heard multiple people say that that's just what they're craving these days.
Barb Stuckey is Chief New Product Strategy Officer at Mattson and an industry veteran specializing in food innovation, trends, consumer behavior, flavor, and technology. Read more about the impact of anti-obesity medications on food product innovation in the March issue of Food Technology. We'll be back with more Omnivore in a moment, but first, this word from our sponsor.
With IFT's new virtual workshops, the learning comes to you. Explore the latest trends, breakthroughs, and research findings that matter most to you, each presented by renowned thought leaders and innovators at the forefront of the science of food community. Learn more and register today at ift.org.
Welcome back to Omnivore. I'm Bill McDowell. Precision fermentation, which uses genetically modified microorganisms to produce compounds like proteins and vitamins, has undergone a remarkable evolution in the past decade, transitioning from its roots in pharmaceutical applications to becoming a potentially transformative force in food production. According to Fortune Business Insights, the global precision fermentation market is expected to grow to more than $57 billion by 2032. Food Technology's Julie Larson-Brisher spoke with process engineer Shalima Sreenath, whose previous work with Beyond Meat focused on scaling up alternative meat technologies, to learn more about the exciting potential of this technology.
Hi, Shalima. I really enjoyed your recent article in Food Tech on the advancements of precision fermentation in the food industry.
Thanks, Julie. Glad to be here.
Well, as a food engineer, you've watched precision fermentation tech mature over the last several years, and kind of making its way into food and ingredient manufacturing applications. So what do you think are the main drivers for that transition from pharma to food?
Yeah, so precision fermentation came about in the 1980s when big pharma company Genentech used their recombinant DNA technology to make human insulin. So insulin was traditionally derived from animals, and they found that precision fermentation was an option to make insulin at a much higher quality and also consistently, removing all the animal to animal variability and all of that. So the same concept is now being seen in the food industry where, we are going from a process where you're extracting the ingredient from a scarce resource to like being able to make it anywhere. So when you look at pharma and food, one of the main things is that, biopharma operates at small scale and they have higher margins. But with food, you need to have like large scale processes and they also need to be cost effective. So one of the main drivers is that in the past decades, there has been a lot of developments in as far as like gene editing technologies go, like CRISPR. And also, we have been able to adopt, whatever advancements has been made in pharma and take it directly and apply it to precision fermentation in food. So that really brings down the cost and also speeds up the process, thus making it more accessible to everyone. I think, and another one is, in the last decade, there is a huge consumer requirement. So there is, consumers need more sustainable food, as well as like there has been a push towards alternative meats where, you need to skip the animal, but, still get the same benefits, and also functional ingredients where, like in the insulin example, it's the same concept, right? Like, it occurs naturally in a tiny amount. So with precision fermentation, you're basically making it accessible to everyone.
So that's interesting, Shalima, that you are mentioning sustainability, because my next question was really around how does precision fermentation offer that more sustainable alternative to the traditional methods of producing foods and food ingredients? And can it really improve our ability to produce enhanced plant-based proteins?
Yeah, so high level, if you're looking at precision fermentation, what you're basically doing is like taking the farm and putting it into a tank. So the obvious benefits are, there is less land, less water, less fertilizer usage. So it is like much less resource intensive. But at the same time, since it's done in a controlled environment in a tank, you're taking away like any weather dependency as well as like, reliance on like geographical factors. So this really, improves food security and, makes makes it accessible to everyone.
Anytime technology involves GMOs, it can create this consumer concern, right, over safety. So, how can scientists ensure that safety and really underscore consumer trust in foods and ingredients that are produced by this method?
Yeah, the interesting thing about precision fermentation derived ingredients is that even though it's made by a genetically modified organism, the organism itself is not present in the final ingredient, because the whole point of downstream processing in precision fermentation is to remove the organism and isolate and purify the ingredient, so that finally you end up with something which is virtually similar and identical to what is derived from the plants. As scientists and engineers, like what we can do is, like, one is GRAS certification. So, qualifying your organism to be, generally recognized as safe. And then the other one is like robust analytical methods, like, HPLC, GC, NMR, which basically, establishes the molecular equivalence of the molecule. So, you can basically say that it's the exact identical molecule to what is derived in plants. And, sometimes even better, because you don't have like a crop to crop variability or, something like that. So I think that's a main, thing to point out, where even though it comes from a GMO organism, it doesn't have the actual organism at the end. But then again, like, from like a labeling standpoint and all of that, like, even though if you're not even though you're not required to label as GMO, I feel like transparency is key, because you cannot deny the fact that you are using a genetically engineered organism. But I think transparency and like consumer education is key there.
Yeah. Well, now, what excites you about future applications um, in this field, especially in the food and egg space?
Yeah, I think one of the things which I'm most excited about is like the synergy between, plant-based proteins and using precision fermentation derived ingredients, because, one of the main critiques of plant-based protein is that the taste is not as good as the animal derived products. And, precision fermentation, we can make fats and flavor molecules which will really enhance plant-based meat. The other main thing, when talking about advancements, is the role of AI. As in any other industry, in the precision fermentation industry, AI combined with the gene editing tools can help with host selection, identify which microbe is like the best for your application. And also, like, AI models can really predict how these engineered strains are going to perform when you put it in a tank and scale up. So that really like reduces the time to commercialization. As an engineer, the other thing which I'm really excited about is like infrastructure development. So there is now, people are realizing that you need better infrastructure for, developing the precision fermentation derived ingredients, because you need, fermenters which are suited to your process, and then downstream, modular facilities which can be like mixed and matched. So there is a huge push now towards establishing pilot scale and also like commercial scale facilities. So that will really help, move these, the cool science which is being done from like just the lab scale to, out to the consumer.
And how do you think, in the end of the day, as far as these bigger goals of sustainability and food security, we hear a lot about that right now. How is precision fermentation going to really help us solve those problems?
Yeah, I think talking about like plant-based meat, one of the and sustainability, precision fermentation can really bridge the gap between like plant-based and animal-based meat, because there are technologies like lab-grown meat which is available, but then it'll take time to achieve cost parity. So precision fermentation is like an excellent interim, because it is providing the sustainability aspects, because you are using plant-based proteins, but then like it's elevating the flavor and aroma, so there'll be like more consumer acceptance. And then again, like I mentioned, like it's avoiding like any like weather and geography dependencies, so you can make it like anywhere in the world where you have accessibility to the utilities, and as well as like feedstock is available. So you're taking the agriculture part out, which I think is like really beneficial.
Well, it's been great talking to you today, Shalima. I'm going to keep watching this space. It does sound really exciting.
Thanks, Julie. Thanks again for having me on.
Shalima Sreenath is the head of downstream processing at Celebrate, where she leads the isolation of novel small molecules produced through precision fermentation, driving innovations from lab to commercialization. You can read her article, Transforming Ingredients Through Precision Fermentation, in the March issue of Food Technology. Obesity policy advocate Ted Kyle thinks it's time to end the bias, blame, and stigma that those with obesity so often face. And he believes the new class of GLP-1 anti-obesity medications can do a lot to move us toward that goal. He thinks that the food industry has an important role to play to help consumers eat more healthfully, and he's got some provocative opinions about the idea of food as medicine, which he shares with Food Technology's Mary Ellen Kuhn.
Welcome to the podcast, Ted. Clearly, obesity and how to treat it is such a complex topic, and it's one that you've been studying for a long time. I'd like to start out today with a quote about obesity that you shared in the context of your Food Technology magazine interview. Genes set the table for it, the environment serves it up, then people can choose what to do about it. Let's talk about that. How much can obesity be linked to genetics, I'm wondering?
That's the eternal question about any condition. How much of your life is determined by your genes or your biology? And it's not an easy question to tease apart, but it is highly heritable. And so, in fact, it turns out that it may be that obesity is just as heritable or more heritable than height. And most people think that their height is something that they have no control over, that it is, it's strictly biology. Well, it's not. It's, both of them are, you could say the same thing about both of them. Your genes set the table, and then the environment serves it up. And depending upon the nutritional status of a child, they will be taller or shorter. And the evidence for that is, if you have noticed, as I have, and I look at younger people who are well nourished, and I see, people are taller than they used to be. And that's been going on for a long time.
Also, in your Food Technology interview, you spoke about the fact that there are multifaceted causes for our current obesity-related health crisis. How much responsibility does the food industry bear, in your opinion?
How does a more obesogenic food supply evolve? Well, think about product development cycles. You come up with 10 different concepts for a product, and you test the concept and say which of these would people be most likely to try, and then you say, okay, take it home and try it, and which one would you be most likely to buy again, and how much of it would you buy? And the one that you try and buy in large volumes are the ones that go on the shelves. And oh my gosh, in each successive generation of the food supply, it becomes more appealing to eat more food, to drive more volume, to make a food company more profitable. The food company's not doing anything evil. They're just giving people food they like and that they're willing to buy in quantity.
Well, so how about the efforts that the food industry has undertaken? They've done things to reduce sugar, to reduce the fat content. What about the overall impact of all of that on health?
I have not seen an impact yet. I've seen reactive responses to criticism, which is understandable. The closest thing to a response that might have been promising was the an initiative in the mid to late 2000s to try to reduce the number of calories in the food supply, and several large food companies joined in that at the time when Michelle Obama with her Let's Move initiative was putting some pressure, and this was a response, and they actually showed some promising results, but it was, people kind of walked away from that for lack of interest and lack of incentive to continue that initiative.
What about now? What do you see opportunities for food companies to develop some different kinds of products in response to the GLP-1 drugs?
I think that food companies have an opportunity to take a really hard look at the quality and value of what they sell and the food culture that they influence through their marketing efforts. And it is not easy. It will not be easy to do, but they will need to think about ways to evolve toward a business model where they prosper based upon selling people a higher quality of food that people enjoy in patterns that are more healthful than the patterns of consumption that are more dominant now that promote obesity.
But are there any kinds of formulations that might be valuable to someone who's using the GLP-1 drugs? I've heard some things about creating more foods with a high protein content, for example.
I've heard that too.
Okay.
But my response to that is that people are speculating, people are guessing, and they might get lucky and find something that is genuinely helpful. I haven't seen evidence that we're onto it. That's not to say that they're not. It's just to say, when it comes to food and health, lots of good ideas take a wrong turn.
So it's kind of too soon to tell.
Yes.
You're coming from the pharmaceutical background, and we're talking about the impact of all of this on the food industry. Do you think there are opportunities for pharmaceutical companies and food companies to form some collaborative ventures to help advance public health?
Not to throw cold water on that idea, but I doubt it.
Well, that's okay.
For the simple reason that food and medicine are very different.
Okay.
Food, medicine is for treating a medical condition. And pharmaceutical companies are real good at figuring that out. Food is to squash an idea that is well intended, but food is not medicine. Food is so much more than medicine and so different from medicine. Food is the very fabric of our lives. It is how we sit down and connect with people. It is a source of pleasure. Medicine is not a source of pleasure. Medicine is for relieving suffering and preventing suffering. Food is for enjoyment and it has a social function and it nourishes our bodies and makes us whole.
Well, there is a whole food as medicine, or even food is medicine movement going
I know
right
it.
now.
I know it. And I have friends who are active in that movement, and the ones that I really respect look at it as, if you want better health for people who have poor access to good food, then better access to nutrition actually does, in an abstract way, serve as medical care. So I can prescribe to you access to a farmer's market where you can get good food and enjoy it. But food is not medicine in that setting. That is where food is something that is missing from a person's life because they are disadvantaged by our social systems and denied access to good and nourishing food. And fixing that problem has an impact on health, but that doesn't mean that somehow food is functioning as if it were medicine. Food is important for good medical care. It's good to assure that people have good good access to food. And that's where, when I say that stress and distress contribute to obesity, someone who is experiencing social disenfranchisement, social distress, disparities in the prospects for their life, those disparities can manifest as, I don't have good access to nourishing food, and so I just have to scrape up what I can, and it's not always the best thing.
It's interesting. This is a very interesting point, because there are, in addition to the food is medicine or food as medicine movement, there's been for decades a whole functional foods movement within the food industry, products that deliver specific health benefits. So I'm guessing you're not a big proponent of functional foods.
I am not. I'm all for eating foods that produce that contribute to good health, but they contribute to good health because they are good and they are nourishing, not because they are acting like a medicine. Medicine and food are two very different things.
Thanks so much for the conversation, Ted.
Ted Kyle, founder of Conscient Health, is a longtime obesity policy advocate. Look for more of his thoughts on the impact of GLP-1 drugs on consumers and the food industry in the April issue of Food Technology.
Thank you to our sponsors for this episode, IFT Virtual Workshops. Grow your career and satisfy your quest for knowledge without the stress and expense of travel. Get all the details on our career development page at ift.org and register today.
And that wraps up this episode of Omnivore. Thanks again to all our guests and my colleagues at Food Technology. Omnivore is produced and distributed by the Institute of Food Technologists. If you enjoyed today's show and want to learn more about Food Technology Magazine or how to join the conversation by becoming an IFT member, visit ift.org/membership. For more in-depth discussion about innovation in the science of food, check out IFT's other podcast, Side Dish, on the News and Publications page of ift.org. If you have comments or suggestions for future shows, just send us an email. The address is editors@ift.org. For the entire team at Food Technology and IFT, I'm Bill McDowell. Thanks for listening, and join us again for our next episode.